saturated MRI is essential. So this is the new NCN classification which came in 2019, and the additional advantage of this NCN scoring system is the application of structured reporting of both your MRI and US into the staging system, so that you can plan the surgery carefully and it can involve the multidisciplinary team. Okay, again, future studies are needed to validate this NCN classification regarding the clinical validity, accuracy, and reproducibility. So imaging has become a critical tool in the diagnosis, surveillance, and surgical planning of endometriosis. Coming to the genetic test in endometriosis, hereditability was already told that is around 50% and a sibling relative occurrence of 2.34. Again, genomic-wide association studies have revolutionized the understanding of the genetic traits, and they are identifying single nucleotide polymorphisms. Out of 27 genomic risks, 13 are novel, and additional 8 novel genes are identified. We are also part of this study, which is going on in SAT. In Indian population also, we are studying this GWA in endometriosis. Again, this will improve, which we can assess the individual risk of endometriosis. You can counsel the woman early. Again, genetic-based diagnostic test and genetic targeted therapies can be done after once this get established. That is the GWA association. Again, microbiome, again, it's coming in a big way. Again, there is an imbalance, what is they call dysbiosis is there in endometriosis. Again, there is an imbalance between the urogenital and the gastrointestinal crosstalk. Again, the strategies, again, you can decide. The further studies are there to the functional profile of the microbiome of endometriotic patients, and may develop, in future, you may have microbiome-based therapy to alleviating the symptoms of endometriosis. Coming to the biomarkers, as this talk is only for 20 minutes, I'm not going into the details actually. Okay, so there are so many biomarkers have been identified which can be extracted from urine, saliva, blood, and endometrium. So coming to one by one, that is glycoproteins. Again, the main thing is the CA125, which has been identified as a very promising candidate, but 200% higher in women with endometriosis compared to the healthy controls. The thing is, clinical studies have revealed that it alone is not a diagnostic marker, and its ubiquitous presence renders a poorly specific marker. Again, individually or in combination, but neither method has proven sensitive enough to be a viable biomarker. Coming to the other biomarkers like glycodyline A, then again it can be combined with CA125 is a good marker. Intercellular adhesion molecules, that is ICOM1 is another marker. There are so many inflammatory cytokines which can be established. All these biomarkers again there are some studies going on behind this. Again, oxidative stress markers like MDA or sucrose oxide dismutase. Again, growth factors like nesfatin, urocortin, leptin, all these things are there. Angiogenic factors like VEGF are increased in endometriosis. Again, autoantibodies, especially the tropomodulin 3, tropomyosin 3, and the stromatin-like protein also is increased in endometriosis. Again, everybody talks about proteomics, metabolomics, genomics, but nobody knows what is exactly it is going on. Again, it is coming up in a big way, and it has got definitely a good role it will play a good main role in the future of diagnosing endometriosis. This is another thing, that is the microRNA, which are non-coding RNAs, which are again very specific. Again, mRNA profiling is usually achieved by microarray, and this has got a very high stability, and this is a promising marker in the future. And again, the role is controversial and equivocal till date. Urinary markers are also there, like cytokeratin 19. MMPs are there again. A combination of uroprotein again has got a promising value in the diagnosis of endometriosis. So many peripheral biomarkers tentatively show promise in the diagnosis of endometriosis, but not a single marker or a panel of markers appear to be clinically foolproof. So further research is warranted before any set of markers of endometriosis may be recommended or for routine healthcare diagnosis and other purposes. So what are the new ongoing studies? That is, first one is the DETECT, that is detecting endometriosis expressed in T-grunts using technetium-99 scan. So again, this is ongoing in Newfield and Oxford. Again, it's an experimental image marker of technetium maraciclatade. Again, it is successful. If it is successful, a 20-minute scan will tell you that whether you are having endometriosis or not. Second thing is Image Endo research team, again from Australia, University of Adelaide. They're combining artificial technology to combine diagnostic capabilities of ultrasound and MRI to diagnose these endometriotic lesions. So another thing is ROSE study From New York, again, they are analyzing the genetic and cellular differences in menstrual blood, which may again is promising. Another one is contrast enhanced ultrasound, that is CUs. Again, you are introducing an intravascular contrast agent and doing a scan. Again, these are all not validated, they are in the study stage. So future, again, AI is coming in a big way. Clinical use of artificial intelligence in endometriosis is coming in a big way, and applying AI to the complex challenges presented by endometriosis will result in diagnosing endometriosis as early as possible. Again, AI methods have been applied to solve pressing issues in endometriosis like diagnosis, prediction, and research. Again, applying AI to assess endometriosis is relatively new, and most AI methods used still are relatively simple, and various data types continue to be explored. However, each data type was utilized exclusively up to date. So AI might come in a big way in future. Maybe in 1 or 2 years, AI is applied everywhere now. So to summarize, endometriosis is a complex process with a heterogeneous phenotype. Diagnosing endometriosis remains challenging, which yields sometimes an average delay of 8 to 12 years is there for diagnosing endometriosis. Transvaginal ultrasound is the first-line management tool. Magnetic resonance MRI is considered as a second-line imaging technique. Imaging that confirms endometriotic cyst or deep infiltrating endometriosis may help in guiding surgical therapeutic approaches, which is very important. Detecting deep DIE is critical in patients with endometriosis, so that you have to have a proper surgical planning. No serum markers has been found to diagnose endometriosis with adequate sensitivity and specificity. Non-invasive diagnostic methods do not qualify formally as replacement tests for surgery in diagnosing all subtypes of endometriosis. They are likely to be appropriate for the advanced stages of endometriosis. Thank you. Thank you for your kind attention. Thank you very much.